Good afternoon. We'll
Yeah.
be starting our session in another 5 minutes.
Okay. Okay.
Good afternoon, ma'am.
Okay. Good afternoon. Okay. It's okay. Carry on. You're Dr. Anirudh. Hi.
Yes, ma'am.
Yeah.
Hi, ma'am.
Okay.
Pleasure meeting you.
Okay.
We're just waiting for Dr. Mahendra to join us.
Yeah.
Good afternoon, everyone. We're awaiting two more of our poster presentations presenters to join us. After that, we'll be beginning. Good afternoon, Mahendra, sir.
चेयर ले लो ना, ले लो बेटा, ऐसे बैठ जाओ, चेयर ले लो आराम से, कंफर्टेबल यार, आराम से लगा लो, इसको उधर कर दो, हाँ हटा दो यहाँ से, इसको उधर सरका दो, ये वहाँ रख दो, आ जाओ आगे आगे, रख लो अपना, बट रख लो कहीं, पकड़ लो।
उधर का खुला है ना, बंद कर।
से बात हुई ना, नीलम से बात हुई?
नहीं, आप बात कॉल कर लीजिए सर, नीलम और अर्पिता से।
अर्पिता का तो
क्या
कर रही है कनेक्ट।
A very good afternoon to everyone present here. I hope I'm audible.
Yes, Dr. Arvind, you are audible.
Thank you, ma'am. Thank you. A very good afternoon to Eficon 2020, the National Conference of Epidemiological Foundation of India, at the All India Institute of Medical Sciences, and to this poster session on maternal, neonatal, and child health. So it will be my honor to introduce the chairpersons for today. Um, we have first with us Dr. Rashmi Kumari, who is MD FCGP, who is the assistant professor of the Department of Community Medicine at the Dr. RML Institute of Medical Sciences at Lucknow, who has more than 20 publications in national and international journals, and has worked as an executive member of IADSMUPK UK. She has worked as a national assessor for effective vaccine management at Bihar in collaboration with UNICEF Bihar, NCCVMRC, and IHFW New Delhi. She has chaired a number of oral and poster presentations at state, national, and international conference, and has participated as delegate in national and international conferences. A second chairperson for this afternoon session is Dr. Mahinder Singh, MBBS MD Community Medicine, who is the assistant professor at the Department of Community Medicine at NC Medical College and Hospital Istana Panipat, Haryana. He has 16 publications in national and international journals and has presented oral papers and chaired scientific sessions in state, zonal, national, and international conferences. It is a pleasure to have you on board, sir. Our third chairperson is Dr. Richa Sinha, MBBS, MD, and an assistant professor at the Department of Community Medicine at GDMC, Dehradun. She has published over 8 scientific papers and has presented 2 of them with 3 projects as well. And her area of interest is maternal and child health, nutrition, and non-communicable diseases, along with contraceptives in clinical practice. Thank you so much, ma'ams and sirs, for taking time out of your busy schedules to be joining us. With this, we'll be starting with our first poster of the day, which is presented by Dr. Arpita Devnath on the prevalence of anemia and its associated factors of pregnant women attending ANC, AGMC, Tripura. Over to you, ma'am.
Good afternoon, respected judges and all other delegates, whoever have joined in this Eficon 2020 through virtual mode. Myself, Dr. Arpita Devnath, third year PGT from AGMC, Tripura. My topic of the this e-poster is, how do I share my this PPT?
Arpita ma'am, I suggest that you press the your share screen. You'd be getting an option to share your screen right now. Can you please press share screen at the bottom corner?
Dr. Anirudh,
Yes, sir.
may I call you?
Sure,
I am
sir.
hearing double sound, echoing, one after another.
Okay, sir. I'll just
Something
try
in
and
the
find out.
background. Yeah, there is something in the
Actually, I'm
background, I
not
think.
able to connect this.
Dr. Arpita, it is written on the screen, the share
At the
screen. You
bottom,
can
green.
go and
Otherwise,
share screen. Yeah,
not a
please take
problem.
over.
Okay, Arpita, ma'am.
Actually, my this screen share option is there, but I cannot I cannot connect this to this.
Okay. Arpita, ma'am, if you can give me 2 minutes, I'll share my screen. I have your presentation with me, so and you can present through that if that's all right by you. Is that visible,
Actually,
ma'am?
there was, yes, visible.
Excuse me, Dr. Anirudh.
Yes, sir.
I am listening two sounds simultaneously.
Okay, sir. I'll just find out and try and rectify the problem.
Okay.
But project. Hello.
Yeah, Dr. Arpita, you can proceed.
Title of my study is Prevalence of Anemia and its Associated Factors of Pregnant Women among pregnant women attending antenatal clinic at AGMC Tripura. Ma'am, should I present whole of the poster?
What is the time limit? I think 5 minutes or 8 minutes? Is there
For
any
oral
time limit for your
presentation, it was
presentation?
5 minutes, but mine is e-poster.
Yeah, so for
It,
e-poster, how much time?
5 minutes is the time given, ma'am.
5 minutes. So just calculate your time and just
I
present,
am
please.
listening double
Yes, ma'am.
sound.
We have a timer starting. If
Yeah,
you all right.
just
Thank
I
you, ma'am.
cannot
check your
scroll
the
down
time.
this PPT.
Ma'am, you can ask me. I
Yeah,
will
doc,
scroll down for you.
Acha.
yeah.
Little bit above
Sure, ma'am.
from the title.
Yes, ma'am. Is that okay?
Title is not visible. Okay. So, starting with the introduction, anemia is an important cause of maternal morbidity and mortality in India. According to National Family Health Survey 4 and 5, the prevalence of anemia among pregnant women in Tripura was 54%, 54.4% and 61.5% respectively. But the proportion of anemic women attending in antenatal clinic is not known till now. So on this background, we conducted this study with the objective to find out the proportion of anemia among the attendees of the antenatal clinic in AGMC. Little bit, can you scroll down the screen? Methodology. The methodology was, it is a hospital-based cross-sectional study, and the study setting was antenatal clinic of the AGMC, and the study duration was 25 days, and the study population was pregnant women. Inclusion criteria were the pregnant women who were attending the ANC of the Department of Obs-Gynae in the Agartala Government Medical College, and the exclusion criteria were those who were repeat visitors, patients with bleeding PV, and who refused to participate in the study. The sample size was calculated by standard sample size calculation formula, and it came around 177. Then we rounded up the figure to 200. Sampling technique we used systematic random sampling. The study tool was a pre-designed, pre-tested structured interview schedule. The data were collected by interviewing each of the participants directly by taking informed consent. Can you scroll down, please? Data were analyzed by SPSS 25, and the p-value of less than 0.05 was considered as significant. And Institutional Ethical Committee of the Agartala Government Medical College has permitted to conduct this study. In the result part, upper side, can you scroll upper side, sir? Little bit upper side. Yeah. In results, we found that the prevalence of anemia was 60%. And when we see the age distribution of the participants, we have seen that 73% of the participants who were anemic were aged 25 years or less. Then in figure 3, it shows that literacy of the study participants were 52.5% were primary educated. And in figure 4, we can see that the 95% of the participants were Hindu by religion. And in figure 5, we can see that 57% of the participants were prime Givida. Whereas in figure 6, we can see that this bar diagram shows that 75% of the study participants used to take less than 100 numbers of tablet. Then this binary logistic regression, this table 1 shows that um, the women who aged 25 years or less had 82.4% higher chance of developing anemia during pregnancy. And similarly, women holding the either BPL or similar cards had 3.42 times more chance of having developing anemia. And women who got married before 18 years of marriage was also having 4.48% times higher chance of developing anemia during pregnancy. The other variables did not attain any significant level of did not attain any level did not attain any significant statistical significance in this study. In conclusion part, we can say that, can you scroll down in the conclusion part, sir? Yes, this study shows that the prevalence of anemia in this study population is 60%, which is comparable to the state prevalence of anemia among pregnant women. Lower literacy rate among women, early age at marriage, lower socioeconomic status, rural residents, etc. were found to be associated with anemia in this population. Thank you.
Okay. Dr. Arpita,
Yes, ma'am.
it was a nice presentation, but the thing is, what different associated factors, that was your objective, you have studied in your research work. What different factors associated with anemia?
Yes, ma'am. I did not get your question. Hello?
Arpita, I think ma'am is asking.
Hello?
Yeah. Hello?
Yes, ma'am.
Am I audible?
Yes, ma'am.
Yes, ma'am.
Then what are the different associated factors that you have taken for your research?
Like this age less than 25 years, then socioeconomic status, literacy, then age at marriage, consumption of IFA tablet.
Okay, then how can you justify the age less than 18 years are 3 times or even 4 times more common there is an anemia incidence, isn't it? In your study.
In this logistic regression, we found that it is
No. I am asking, how can you justify by your research, what are the factors, what you think responsible? This much difference in the anemia prevalence, less than 18 years, females have 4 times more chances of having anemia more. What will be the factors so that we can further, control that factor?
They are not taking this IFA tablet regularly. The consumption of IFA tablet is...
No. What is the big issue about the age? Then why? Means consumption of IFA with the age, how can you justify this statement? Means below 18 years, why they are not taking IFA? What is the reason?
Maybe they are not, this literacy level is not that much. So they did not know.
How can you justify less than 18 years are not illiterate and above 18 years means like the 20 years, because you have taken only the less than 25 years, isn't it? of
Yes,
your
ma'am.
beneficiaries. Next thing, you have taken your study as 25 days of study, isn't it?
Yes, ma'am.
So how can you get 200 sample size in 25 days? This is not possible.
Ma'am,
200 pregnant ladies. Yeah,
we were allotted 10 days for data collection in the antenatal clinic.
yeah.
So,
Okay. Then, yeah. How can you calculate number of pregnant ladies in your area? What is the
this
birth rate in your area? Birth rate.
birth rate,
How can you calculate? Have you any idea? Number of pregnant lady will be within 1 month in your area. I can't think within
actually
25 days. Yeah.
I have gone through the registers of the OPD. So on an average, 80 or 100 patient comes. Minimum 80 patient comes per day.
No, no.
So we had
80. Listen, 80 pregnant lady, new registered pregnant lady came to your OPD daily.
yes, ma'am. Not new registered, not new
Okay.
registered. On an average, repeat visitors also come, new registration also come.
But you are taking a repeated means repeated visitors or repeated pregnant or same pregnant lady daily.
No, ma'am, I have excluded those who were
Yeah,
repeat
that's why I'm
visitors.
asking now. What is the birth rate in your area? It's not possible within 25 days you get 200 pregnant ladies. You have taken retrospective study, means you have taken the data from your registered or whatever the entry in ANC registered, isn't it?
We went there in the OPT.
I know, but this is not possible. What keep in your area within 25 days you get 200 pregnant ladies, newly pregnant ladies. This is not possible. Whatever be the birth rate in your area, you have to calculate number of pregnant lady in your area by the birth rate, isn't it? 10% will be loss also. Then this is your, and you have said this is a simple random sampling, isn't it? Then how can you say simple random?
Systematic.
Because systematic random, whatever. This is not systematic random also. This is simple random samples. And you have taken the retrospective data.
No, ma'am, we went there and we collected the data in the OPD itself.
Okay, then what is the birth rate in your area? Then tell me. How can it possible 200 pregnant lady came to your OPD, 80 pregnant lady means on and off within 25 days means four newly pregnant lady you got eight pregnant lady you daily got in your OPD. How it's possible? Then what is the birth rate in your area? You understand my point?
Yes, ma'am.
You understand my point?
Yes,
Within
ma'am.
25 days, how can you get 200 new pregnant ladies? This will be not possible. If you take a retrospective data, it's okay. We have analyzed within 25 days and we have taken the entered ANC patients for last whatever 1 year or whatever ANC clinics. But within 25 days, it's not possible that you will get 200 newly pregnant ladies. Okay.
Excuse me, ma'am. Ma'am, would it be
Yeah.
possible for us to round up the questioning session, as since you
Yeah.
seem to have overshot the time limit regarding this?
Okay, okay, okay. Then we can put the question session at the last.
Sure, sure, ma'am. We can either do it here or at the
Okay,
last, but we can
okay, okay,
after the speaker, we have say about 2 to 3 minutes. Each speaker is allotted time for about 5 minutes to speak,
okay.
and two
Yeah,
to three
yeah.
minutes for follow up
For the
questioning
question
from
hour. Okay.
the chairpersons, ma'am.
Yeah, yeah. Just go ahead. Next speaker. Just call the
Okay.
next. Okay.
Sure, sure. Mahinder sir and Richa ma'am, if there's any more questions from your side, otherwise if I have the permission to move on.
Yeah, I
All
have a
right.
question.
Yeah,
Dr. Arpita,
you
hello,
move on. Move
hello,
on, please. Move on, please.
hello.
So, Mahinder sir, we'll take it in the end. Otherwise, sir,
Okay, okay,
after all the other speakers are speaking, there are
okay,
only a total of 3 speakers.
okay.
I now request Neelam Kumar to present his paper on quality assessment of Haryana Swasthya Vahan Seva for obstetric and newborn care. I request Neelam Kumar to please present his screen. If
Again,
Dr. Neelam Kumar, are you there?
yes, I am here.
Hello, sir.
Can you display my poster, e-poster?
Sure, sir. Just give me a minute. I will just do that, sir.
Please, please display my e-poster. Uh, what could be?
नहीं नहीं सर ये यहाँ पे पोस्टर नहीं है इनको ढूंढ रहे हैं
Just a second, sir. Is that visible?
Hmm. Not completely. Part of it is visible.
All right. So just a second. I'll just.
Yeah, okay, now I start. The topic of my presentation is quality assessment of Haryana Swasthya Vahan Seva. Uh, it is quality assessment of Haryana Swasthya Vahan Seva for obstetric and newborn care. Introduction. TDS and Mane has described three crucial delays in access to obstetric care services. First, delay the decision to seek care. Second, delay arrival at health facility. Third, delay the provision adequate care. The delay in arriving at a facility after decision has been made to seek care was referred to as second delay. Most households, especially in rural areas, do not possess a personal vehicle, thereby necessitating their reliance on public transportation. Reduction of maternal mortality rate, MMR, and neonatal mortality rate needs easy accessibility to emergency obstetric care and neonatal care facility to all women having obstetric complications and for neonates having morbidity which require a well-functioning referral system. Aims objective to it is to assess the utilization of referral transport for obstetric and neonatal care and determinants affecting it. Material methods, study area, rural area of district Rohtak, Haryana, study population, mothers having children within 1 to 3 months of age, and ambulance drivers at the selected health facility. Study design was population-based cross-sectional study. Study period August 2013 to September 2014. Study sample 360 sampling technique, multi-stage random sampling, study tool, a pre-tested semi-structured interview schedule. Methodology. All 5 CSC were chosen and 2 PSC from all CSC were randomly selected and 2 sub-center from selected PSC were chosen. In total, 20 sub-centers were selected, 18 females who deliver between last 1 to 3 months. At the time of visit to the sub-center were taken in the study, so total sample size was 360. Out of these, 349 could be contacted. Ambulance was used by around 2/5 of 30% of study participants. This slide, either for delivery or other obstetric and neonatal morbidities. Among total participants who accessed ambulance, around half, that is 48.2% were satisfied from ambulance services, while rest of 51.8% were dissatisfied. Among those who access ambulance, most, that is 58% subjects, were dissatisfied due to late arrival of ambulance. Rest reasons were that staff was not cooperative, 22%. Sometimes drivers demanded money from participants, 7%, due to the reasons that they were not aware that ambulance is free for pregnant women and neonates, apart from delivery cases. These are the reasons of dissatisfaction about ambulance services, displayed as a pie chart. Conclusion: awareness about free entitlement of ambulance services for obstructed.
Thank you so much, sir. Thank you so much,
Uh,
sir. I
appropriate.
leave.
Oh, okay, thank you.
This is if you're done with your presentation, sir, we can move on to the question answer session if that is all right with you, sir.
Okay, sir. Okay.
Hello. Hello.
Hello, sir.
Dr.
Hello.
Neelam, may I ask you a question?
Yes.
Hello.
Yes, sir.
Due to study on quality assessment of referral transport system on Swasthya Vahan Haryana, can you tell me how many calls were received in the referral transport system in control room, and how were attended within 30 minutes, and what was the response? Who were the maximum callers?
No, that right now I cannot recall.
Whether how many ambulances were available in your area, and what is the reach time? Whether all the calls were received in time and the ambulances were reached in time within 30 minutes to the destination and to the hospital, so that we can avoid the mortality of the women, pregnant women. Have you such type of data?
58%
Okay,
arrived
all the ambulances were fitted with GPS.
as late.
We asked the people,
GPS was not there.
No, why? Then how can you check that the vehicle is moving in the proper direction and within time? There should be
We
GPS
asked
fitted
the
in each and every ambulance.
people. We asked the people there in the area.
No, that all the ambulances should have GPS fitted in the ambulances that can check by the control room operator. And have you checked how many calls were attended and responded well in time? Who were the callers, maximum ASAs or ANMs or the beneficiaries? Have you such type of data?
Yeah, and they were ANMs mostly.
You have no such data. Hello.
No, presently no such.
Then
No
how
such
can you
data
check the
is there.
quality if there is no GPS system is fitted?
They asked directly from the beneficiaries.
Okay, whether they are telling correctly, you have to check the system also, RTS referral transport system, where the control room is set up at district headquarters, and GPS also you will get the information that the ambulance reached in time. What was the maximum and minimum time calling and attending the call, reaching at the destination?
Maximum time, I think it was half an hour.
No record. Okay, thank you.
Okay, thank you.
Thank you so much, ma'am. Thank you so much. Thank you so much, sir. Thank you so much, Mahendra sir, as well. We will now be moving on to our final speaker for the afternoon, which is Dr. Preeti, who would be presenting on early initiation of breastfeeding and its associated factors among 0 to 23 months children in Haldwani.
रूपाली बंद करो
Uh, Dr. Preeti, if you have your poster available, and if you don't have a problem in sharing your screen at the bottom of your Zoom
So I'll
presentation.
try. Yes.
Thank you, ma'am.
Yes. Is it visible?
Yes, ma'am.
Okay then. Good afternoon, respected judges, delegates. My title of the poster is Early Initiation of Breastfeeding and its Associated Factors among 0 to 23 months children in Haldwani, District Nainital. Introduction. Early initiation of breastfeeding, defined as initiation of breastfeeding within 1 hour after birth, is considered as one of the key interventions in ending preventable neonatal and child deaths and improving child survival. Although initiation of breastfeeding is one of the core indicator for assessing infant and young child feeding practices, it is far from universal practice. Globally, only 42% of newborns were breastfed within 1 hour of birth in 2017, an increase from 37% in 2005. The information may help to improve early initiation of breastfeeding practices and initiate interventions to accelerate the achievement of Global Sustainable Development Goal 3.2 of reducing preventable newborn death to 12 per thousand live births by 2030. The objectives of the study were to estimate the prevalence of early initiation of breastfeeding and to determine its associated factors among 0 to 23 months children. The methodology was it was a community-based cross-sectional study that was carried out among 339 children aged 0 to 23 months in the field practice area of rural and urban health teaching center, health training centers, that is RHTC and UHTC, in the um, Department of Community Medicine, Government Medical College, Haldwani, for a period of 6 months using simple random sampling. The result was in May, out of 339, there were the male that were early initiated was initiation of breastfeeding in males was 64, and in females that is 89. And the other factors that we have taken, that like education of mother, the 25 out of the all 25 were illiterate, and the place of delivery home, there were also home deliveries in the setting. And the conclusion of the study is early initiation of breastfeeding practices was found in almost half of the children, which were significantly associated with various factors, highlighting the importance of addressing these factors to improve early initiation of breastfeeding. Thank you.
Thank you, ma'am. If any of the chairpersons have any questions for Dr. Preeti, they're most welcome to address them at this point in time.
Yeah, hello.
Yes, sir.
Hello. Hello. Hello, Dr. Preeti.
Ji, sir.
Yes, sir, you're audible, sir.
Okay. How many deaths can be averted through this initial breastfeeding? Have you such type of data?
No, sir.
About 17% death can be averted by feeding maybe within first or after birth, number one. Number two, is there any role of kangaroo mother care in this? Because in the KMC also, we advise to give breastfeeding within first hour after birth and skin to skin contact.
Yes, sir.
So, is it beneficial?
Yes, sir.
Can you include this in your topic?
So we can, but we haven't taken that data.
Most of the newborns are premature and having
Yes.
low birth weight.
Yes, sir.
So the new concept is there, and in India also under NHM this KMC has also been started in facilities as well as in community-based care.
Yes.
Okay, nice presentation. Thank you.
Thank you. Thank you, sir.
Rashmi ma'am or Richa ma'am, if you have any questions for this speaker or any of the other speakers.
Yeah. First thing, what is the registration number of this Neelam Kumar and Dr. Priti?
Neelam
Can you
Kumar's
tell me?
registration number is 188, ma'am,
Yeah.
and
And Dr.
Dr. Preeti is 155.
Okay, thank you.
Should I
Next
stop
thing,
sharing my screen?
yeah.
Okay.
Dr. Preeti,
Yes, ma'am.
in your study, what are different other factors which are responsible for delayed initiation of, breastfeeding?
Ma'am, there
Only
was
studied about the education of mother and no, second is literacy status, isn't it?
yes, ma'am. Ma'am, the other are cesarean section and normal
Yeah.
cesarean section mainly, and
Go ahead, go ahead.
operation of the father we have also taken, and
No, in your presentation you have mentioned only two factors,
yes,
isn't
ma'am.
it? Male, female, and place of delivery and education of mother.
Yes, ma'am.
It's only ki, by your study we can think ki only by educating the mother we can start early initiation of breastfeeding.
Ma'am, this is a major factor. If we educate them in the ANC period, that will be helpful. But in my study, I have seen that in cases of in cesarean section, the people delayed initiation of breastfeeding, and
No, listen. In our Indian scenario,
yes,
isn't
ma'am.
it? We are working in India, or in what setting, what we work, you better understand. Then is it the only mother or the female who is responsible for delayed initiation of breastfeeding?
No,
I
ma'am.
don't think so. I don't think so.
Yeah, ma'am.
So by your study, what you have studied is good, but you have to make aware of other factors also, isn't it?
Yes,
Because
ma'am.
you have got a very large sample size, 339,
Yes, ma'am.
isn't it? There are other factors. I think there are lots of cultural reasons
Yes,
and
ma'am.
other factors that are responsible for delayed initiation of breastfeeding.
Yes, ma'am.
And place of delivery, I know. And as per my knowledge, this hospital delivery or the citizen sections or in private or in government, they are also one factor that are responsible for delayed initiation of breastfeeding, isn't it? Or for exclusive breastfeeding. Okay, thank you so much.
Thank you.
Okay, so Dr. Anidit, we can conclude our session.
Absolutely, ma'am. Absolutely.
Yeah, thank you so much.
It's
It was nice presentation.
absolutely, ma'am. It's been a pleasure chairing this. I beg your pardon, coordinating the session as well.
Yeah,
Thank you
yes,
so much, Richa ma'am, Rashmi ma'am, and Mahinder sir for taking time out and
yes.
chairing the session. A humble request to please fill in the Google form which have been sent to you on the WhatsApp group,
Google Form.
and regarding
Okay,
each participant, and if any assistance is required, Team Eficon is
yes,
always available on WhatsApp, and feel free to let us know if anything else is required.
okay,
Thank you so much.
okay. Thank you so much.
Okay.
Thank you.
All right.
Thank you so much.
Thank you, Richa ma'am.
Thank you.
Am I audible? Hello. Coming together is a beginning, keeping together is a progress, and working together is a success. Good afternoon, everyone. Thank you for joining us for this webinar. My name is Sanjana and I'm coordinator for this poster session. So I welcome you all to the National Conference of Epidemiological Foundation of India, Eficon 2020. It's my indeed privilege to welcome you all and our chairpersons for chairing this session and our presenting authors for presenting their posters. Our first chairperson, just wait a minute.
हो गया There is a background noise coming.
Hello, sir.
The background sound is coming.
Actually, sir, we are sitting in a hall and all the sessions are going on there.
Okay,
Yeah.
okay. No problem.
Yes, sir. So our first chairperson is Dr. Deborati Debinath. Our first chairperson is Dhruv Jyoti Debnath. He is associate professor in community and family medicine, AIMS Mangalagiri. He is faculty for several research methodology workshops and nominated by Government of India for National TOT on programmatic management of drug-resistant tuberculosis. He is chairperson and co-chairperson, judge of several scientific and plenary sessions in national conferences. He has done several publications in national and international indexes journals. He has presented many scientific papers in national and international conferences. He is reviewer of international and national indexes journals and he is reviewer of IA PSMS textbook of community medicine. Our next chairperson is Dr. Chandresh M. Pandya. He is Joint Secretary and National IAPSM Associate Professor, GMERS Medical College, Gotri, Vadodara, Gujarat. He has having total 28 years of working experience in public health in different capacities. He is master trainer for various training programs like IMNCI, FIMNCI, IYCF, STI, RTI, HIV/AIDS immunization, NCD, COVID-19, etc. He is reviewer in various scientific journals like IJCM, Healthlines, etc. And he is member of RRT for Government of India and WHO for Bihar State for polio eradication activities during 2015. He is member and ethical and technical review committee, faculty of family and community sciences, MS University of Baroda. Last chairperson we have Dr. Harjot Singh. He is associate professor community medicine, SGRDI, MSAR, Amritsar. He is currently working as Associate Professor, Department of Community Medicine, Shri Guru Ram Das Institute of Medical Sciences and Research, Amritsar, Punjab, India. He is having international fellowship in palliative care from WHO Collaborating Center, and he is Secretary of National Association of Palliative Care for Ayush and Integrated Medicine Punjab chapter. and he has done more than 5 research articles in different national journals.
Thank you for the kind introduction.
Yes, sir. So, our first presenting author is Dr. His title is Does Media Matter in Society? A Matter for India and Archival Analysis. Sir, please.
Hello, am I audible?
Yes, ma'am. Sorry, I thought you are. Yes, ma'am, please. You are audible.
Should I share my screen or?
Ma'am, you have to share your screen.
Okay, okay.
Ma'am, she left, I guess.
She left.
Dr. Payal.
Yeah, we can hear you, ma'am. Go ahead.
Sorry for the inconvenience. Maybe she's having network issue or some other issue. Hello? Yes, ma'am. Ma'am, please connect it again. I would request to our next presenter, Dr. Mohana BP, to present her poster because we are having some problem with the joining with Dr. Payal. Ma'am, can you present Dr. Mohana?
Huh, can you hear me?
Yes, ma'am, but there is some issue with the voice. It is lagging, ma'am.
Okay, 1 minute.
Yes, ma'am. Now it's okay.
You can hear now, right?
Yes, ma'am. Ma'am, you need to share your screen.
Okay.
Yes, ma'am.
Hello, can you see the screen now?
No, ma'am.
Is it visible now?
No, ma'am.
Okay, I'm actually presenting the screen, but it's not visible.
Uh, Ma'am, from our side, there is no problem, ma'am, actually.
Okay.
Dr. Mona, you can click on the share screen and then share the PowerPoint. First, click on the share screen.
Yes, sir. I'm sharing the screen, sir. Is it visible now?
Yes, ma'am. It is coming now. Yes, ma'am. Yes, ma'am.
Okay. Good afternoon, one and all. My name is Dr. Mohna. I'm from LIMHANS and I'm currently doing my master's in public health. My study is an archival study on the portrayal of depression in electronic media in India, how posts and pictures matter. So we have taken the concept of depression and how it has been portrayed through electronic media like the Facebook, Twitter, and Instagram. And we have also considered the print media like newspaper and magazines. Uh, Depression, as we all know, that depression is a leading cause of disability worldwide that requires a multifaceted approach. We cannot ignore the media with its pervasive reach. It has a huge potential for intervention opportunity, for awareness generation and help seeking towards the depression. Our objective was to explore and describe the nature and extent of presentation of depression in media from an Indian context. We had done a literature review, we came to know even though media can be used to protect against mental illnesses, as they support the social interaction and also provides a connection between the users to express their emotion. There are also a miscommunication and mismanaged expectations that leaves the individual with a greater sense of isolation. For the methodology, we have collected the presentation of depression from electronic media, like I've already discussed, Facebook, Twitter, and Instagram. For print media, we have considered the newspaper and magazine. For the first step, we had considered these content between the 1st of October to the 31st of December in the year 2018. And for the second step, we had considered the data between 1st of October and 31st of December for the year 2019. Then we had done a comparative analysis of these archived contents, and we had collected the data using the key terms like depression, depress, and mental health, and we have searched it across Facebook, Twitter, and Instagram, and any articles that was related to depression and mental health from newspapers and magazines. So these are our findings. In the results, we have the total number of posts that is analyzed. We total sample taken was around 4097 in the year 2018. In 2019, we have taken 4118 posts. For Instagram, the number of unrelated posts was highest at 584 number of posts were there, and posts that was related to stigma was around 2 to 3, followed by brooding posts that showed sadness, which was around 413 posts. And on Twitter, we found that the negative impression posts, the negative expression posts were around 510, and posts that were related to self-harm was around 16 to 17. If you see here, the number of posts for positive interaction and social support is also high, that is around 445 and 435 respectively in the year 2018, which has slightly decreased in the year 2019. In Facebook, we saw the number of unrelated posts was the highest of about 81 and 78, and posts that were related to stigma was around 1. In newspaper, the posts that related to hope, help seeking, awareness, creative artwork, stigma related, and self-harm related were categorized. Around 11 posts were related to self-harm, and 31 posts, which was the highest number of posts, those were related to awareness. In the magazine, we found that it was around 17 and 14 for awareness creation, and 23 to 26 posts that was related to self-harm. We imply with this study that there is an increasing use of social media. There is a need to harness the potential for positive factors while continuing to modify its risks. There is also a complexity of the online environment. So it is required to understand the nuances for responsible use of media and the importance of examining the content and quality of interaction and messages to aid health communication policy making, which will help in depression prevention. In our study, we try to highlight the current depiction or scope of media, which is really in presenting the depression. So hereby what we are trying to say is, if we ensure accurate, responsible and ethical interaction or reporting, this will become a critical challenge for addressing the depression through media. Thank you.
Ma'am, please stop sharing your screen.
Yes.
Okay. Thank you, ma'am. Thank you for this mindful presentation, ma'am. So next presenter we have Dr. Payal Mahapatra. Ma'am, are you there? Next presenter we have Payal Mahapatra. Ma'am, please share your screen. Hello, ma'am. Thank you so much, ma'am.
Hello, ma'am. Hello,
Yes,
ma'am.
ma'am.
Ma'am,
Yes,
am I audible, ma'am?
yes, ma'am. You're audible.
Is it visible, my screen?
Yes, it is visible.
Okay. I'm extremely sorry for the technical glitch. Shall I start?
Yes, ma'am. Please start.
Okay. A very good afternoon to all. Today the topic of my presentation is Does Media Matters in Suicide, a Matter for India, an Archival Analysis. So as we all are aware about the fact that suicide has become a critical global public health concern, and India accounts for more than 26% of global suicide deaths. So it has been also recognized that that responsive communication of suicides can be a promising suicide prevention strategy at the population level. So with this in background, we intended to explore the nature and content of suicide communications in electronic media in India. Now, coming to the methodology section, we did a content analysis study with archived articles reporting suicide-related communications in e-edition of English newspaper in Karnataka and in electronic media, that is in Twitter and Instagram, for the period of 3 months, that is from 1st October 2019 to 31st December 2019. So we used a Boolean search strategy with the following key terms, that is suicide, suicide, mental health, mental illness. And the contents were selected using simple random sampling, and then it was categorized using inductive thematic analysis. The newspaper contents were also assessed against WHO suicide reporting guidelines. Now coming to the result part, we have examined over 2,700 posts in Instagram, and more than 1,800 posts in Twitter, and more than 1,100 posts in newspapers. The result we got here is Instagram had highest number of presentations related to suicide based on the scroll time. And what we can see here is that the number of posts related to positive interactions that express the positive interactions were more in Twitter compared to Instagram, and the social support related posts were more in Twitter compared to Instagram. But the stigma and self-harm related posts that were also more in Twitter compared to Instagram. Now, if we see the overall picture in electronic media and in newspapers, we can see that the percentage of positive communications are more compared to negative communications, both in Instagram and Twitter, and also the e-newspapers. And what we have seen is that suicide helpline was provided in most of the newspapers, but most of them did not conform to the guidelines that have been given by WHO. So I would like to conclude with saying that the study highlights the valuable missed opportunities and the need for responsive communications through the common media as per the prescribed guideline to educate the general public about suicide and prevention as their because of their pervasiveness and their impact on general public. And we have a WHO guideline, and recently also Press Council of India has also given a guideline for reporting suicide in newspaper, but we don't have such guidelines for social media as of now. And we also this study also highlights the fact that that artificial intelligence and machine learning, if we integrate them on the digital platform, it will have a significant impact on suicide prevention in a broader scale. And we also need a broader national suicide prevention strategy to ensure accurate, responsible, and ethical reporting of suicide through these medias. Thank you.
I have few questions. Dr. Pai,
Yes, sir.
is your study approved by Institution Ethics Committee?
Yes, sir. Yes, sir.
And what was the criteria of selecting this post? Like Instagram, you said you have examined some more than 5,000 posts. So what was the criteria of selecting this post?
Actually, sir, it was based on the scroll time. Like if we scroll in mobile or in laptop, if we scroll, if some 10 or 15 posts are coming on the screen, so we are randomly choosing 1 or 2 posts from them. So it was a simple random sampling. So.
Any question from any other chairperson? Arjot Singh sir is there.
No, sir. Thank you. Very well presented.
It is interesting. Both the studies are related with the media and depression and suicidal.
Yes.
What will be the impact if you are doing your study in COVID era?
No,
Did
sir,
you find any difference?
No, sir. Actually,
Just
sir,
for
okay, sir. Yes, sir. If we the news and all what we are seeing that because of the COVID, the cases of depression or suicide deaths are actually have increased. So if we do a comparative study, we can see that how much it has increased and how much is the impact of COVID on mental health.
What do you think? It has increased or decreased? What is your perception? You might have some data on that.
So the mental health has COVID has a undoubtedly impact the mental health of the population, that we can say for sure, but the amount we have to, like how much percentage it has increased, and the comparative studies that we have to do, then only we can tell the amount, a percentage of increase or decrease or whatever it is.
Chandresh sir, any other question? Dr. Chandresh, sir. Any other presentation?
Hello, sir.
Any other presentation is there?
Yes, sir. We had two presenter only, and they have presented. Other one have they have withdrawn their name actually. Dr. Neha Sharma and Dr. Neha Verma and Manisha Nagpal. They withdrawn their name. So it's all about our poster presentation. So I would request our chairpersons to share their views if they have any, and if they have any queries or questions regarding to the posters.
I think Dr. Chandresh Pandya sir has logged out or some problem is there. We can just find out. He is not there.
Ma'am, can you stop sharing your screen?
Yes, ma'am.
Thank you, ma'am. Thank you.
Both the presentations were nice. Yeah, in times of COVID-19, really it has taken a toll on the mental health of the population. We would like to find out like what is the actual suicide proportion, whether it has increased or decreased. Maybe future we do some studies and we expect some studies from men's regarding this.
Hello, sir.
Sir, any questions, sir? Dr. Chandresh, sir?
No, no, no.
Ajot Singh, sir?
No, sir.
Okay.
Thank you. Very well organized conference. Thank
Yeah,
you.
nice organized.
Yeah.
Thank you for the invitation.
Yeah,
Thank you.
Thank you, sir.
Thank you.
organizers.
Thank you, sir.
Thank you, sir. Thank you, sir, for being with us here in this webinar. And it was our privilege. Thank you so much, sir.
Thank you.
So you can lead the meeting.
हाँ हाँ वो ड्राइव कर रहा है बंदा उसका जिम जाना पड़ा है